Hi, my name's Leslie Applegate, and I'm a former internal medicine chief resident for our long block program here at the University of Cincinnati. I'm currently an associate program director in our Med-Peds program, and I'm really excited to tell you about our Ambulatory Boot Camp, or ABC, that we started last year. So here at UC, we really value educational innovations, and about 14 years ago, we were part of the Educational Innovations Project from the ACGME, and we started our ambulatory long block. This is a time between November of your second year and October of your third year of residency where you're really submersed in the outpatient environment and become the primary care physician to a panel of about 200 patients. But most of your first year in our program will be inpatient based, and we want you to focus on this work during that time. But it would be really difficult to be ready for the ambulatory long block if you didn't have any exposure to the outpatient setting. So last year we collaborated with a large group of residents, both those who hadn't done the long block yet and were looking forward to starting that experience, those who are currently in the long block, and some of them who are already finished the long block, along with our clinic staff and our clinic faculty. We worked really hard to understand what skills and knowledge residents need in order to be successful during the long block and to understand our residents' perspectives on the best way to learn these skills. Ultimately, we created the Ambulatory Boot Camp, which is a 2-week rotation during the beginning of your second year, where you're immersed in the ambulatory center, learning the skills that you need to join our high-functioning ambulatory microsystem. Our experience consists of 3 parts that are learning, serving, and assessing and reflecting. For the learning portion of this rotation, you'll spend 4 half-days per week in small group interactive learning sessions led by our ambulatory faculty members to master the skills and knowledge that are essential for practice in the outpatient setting. You'll learn how to use the outpatient EMR system effectively, how to use high-value communication techniques during your outpatient visits, how to utilize our support staff within the ambulatory practice, so our nurses, MAs, social workers, and care managers. And you'll also be introduced to the management of outpatient preventative care and common outpatient problems like hypertension, diabetes, and chronic pain. For the serving portion of this rotation, you'll spend 4 half-days per week in the clinic managing both acute patients and follow-up visits. Each resident sees about 3 to 5 patients per session, so it allows you to have some time to really learn the skills that you need in that outpatient setting and become familiar and comfortable with them before you start the long block experience. You'll work closely with the faculty preceptors and the clinic staff to deliver really high-value care to our patients. For the assessing and reflecting portion of the rotation, you get assessed on your new skills that you obtained during ABC, and this is just a way for us to make sure that the education we're providing you is effective and that you're gaining the skills that you need to learn. We ask our residents to give us feedback constantly, and so we're always updating and changing the curriculum and adding or subtracting experiences based on which ones are effective and which ones aren't. You'll also have time to learn from the long block residents during this time before you take over their patient panel. We call this the column of care, and each resident in the long block hands over their entire patient panel to a new resident once they start their long block. The long block's all about developing continuous healing relationships, and ABC is there to get you ready to do this. It's been really successful, and we're really looking forward to involving you in this program too.